Good morning, and welcome to another edition of Johnny Bill's Pharmacist World. And hello, class of 2022. Thought I'd go over some things about lab number 2 today. First of all, lab number 2 is going to be your dental gel and your lip balm. And then you're going to have a prescription label we're going to make for Coumadin. So the first thing we wanted to look at is make sure that you've taken a look at Dr. Hussein's beyond use dates from his emails. And we need to be aware that the dental gel, we're going to put a 30-day beyond use date on that. And on the lip balm, we're going to put a 6 months beyond use date on that. You need to be aware that these come from USP 795, the older version, and the newer versions have not been implemented yet, but they probably will be someday. But for now, they're indefinitely suspended. But what will happen there is that lip balm will probably go to a 90-day or 3 months, and the dental gel may go to 14 days, but it may stay 30 days. Dr. Hussein will clarify that for you. I may be wrong on that last point. But anyway, you need to realize that for non-aqueous formulations, the beyond use date is no later than the earliest expiration date of the ingredients, or 6 months, whichever comes first. For water containing oral formulations, 14 days. For water containing topical formulations, the beyond use date is no more than 30 days. So be aware that we're going to put 30 days as the expiration date on the dental gel, and we're going to put 6 months as the expiration date on the lip balm. Okay, I do want to just say too that I think that the addition of the unguentator to the mixing of the dental gel has added quite a bit of elegance to the product. It dissolved pretty well, was very smooth anyway, but I think that the unguentator is a great addition to this lab and that you should pay particular attention to that. That is a beautiful piece of equipment. It's expensive. And if you have the opportunity to be in a pharmacy that has an unguentator, you've definitely got an advantage to a more elegant product. We're going to make the dental gel. It's a lidocaine 2%, carbomer 940 with alcohol and propylene glycol and purified water. We're going to make a label that says you're going to fill it under your name and your prescriber that you added last week in lab number 1. And then you're going to put the directions to apply to affected gum 3 times a day as needed for dental pain. We're going to probably put every 8 hours for enhanced labeling there, and the refills say PRN, so we're going to put we're going to discuss how many days supply that would be for this and how many refills, and we'll go over with you in lab what to put under the directions and the refills. So that's the dental gel. The lip balm is a very unique formulation. You will not often use an applicator like that, and it's a camphor and phenol and menthol, 1% of each in a lip balm base, and it's a very interesting formulation. I still carry around some of the tubes from the previous years in my lab pocket and use this lip balm. It's a very good product and it works really well, and I still use it myself. You'll notice that from what I talked about in the first video I made for you is in the SIG it says M.FT. 1 applicator full, apply PRN on chapped lips. So that means mix and make 1 applicator full, apply as needed on chapped lips. And again, the refills marked PRN. We'll figure out what a day supply is and we'll instruct you what to write on your label there. So you're going to, Dr. Mullins will go over in lab what exactly he wants you to put on the label, and whether we're going to print them and put them in the lab book or on the product. Also, we're going to have a pre-printed prescription for Coumadin. So let's discuss Coumadin. I've had a lot of experience with Coumadin over the years. I did my research paper in pharmacy school 34 years ago on Coumadin, so I've kind of had an interest in this drug. It's an amazing medication. The prescription will be under your name and your prescriber, and it's written for Coumadin, 8 milligram, a quantity of 30 with no refills indicated, and it says 1 tab PO Monday, Wednesday, and Friday, and then .SS .SS means 1/2 tablet on Tuesday, Thursday, Saturday, and Sunday. So we're going to discuss the labeling of Coumadin, which is warfarin. We're going to discuss an 8 milligram. Does it come in an 8 milligram? We're going to discuss the alternating dosing of Monday, Wednesday, and Friday. We're going to discuss the blood tests that for anticoagulation, what is the proper INR range for this drug, how it's adjusted. But anyway, we're also going to say, should this have no refills? We're going to look at, should this drug have no refills? This drug should always be refilled, but the doctor wants you to go to the Coumadin clinic in this case and get your blood tested to see what your INR is before writing further refills, because Coumadin is a drug that has to be adjusted, and sometimes it has to be adjusted a lot, sometimes not. Every patient is different. It's a very individualized dosing situation with this medication. So let's talk about Coumadin for a minute. And well, first of all, and in this class, we're going to look at the package insert, and I'm going to teach you what a great source of information package inserts are. Here's the package insert for Coumadin. So any drug that we go over in class, if you want to just Google Coumadin package insert and bring this up, the brand name is owned by Bristol Myers Squibb, and you'll see a PDF file that has the prescribing information that's available in the package insert. First thing we see is a bleeding risk black box warning, warning about fatal bleeding and performing regular INR, which is international normalized ratio, and you want it to be between 2 and 3. 2.5 is a perfect INR, but nothing is perfect. We have to instruct patients about the prevention and measures to minimize the risk of bleeding and what those symptoms are. Coumadin is a vitamin K dependent clotting factor inhibitor. It inhibits the clotting factors 2, 7, 9, and 10 in the liver. And it's indicated, if you see under indications and usage, for reduction of the risk of death for recurrent myocardial infarction, heart attacks, or for thromboembolic events such as stroke or systemic embolization after a heart attack. So it prevents clots after heart attacks. It also is used for the prevention and the treatment of complications for valve replacement or for atrial fibrillation. It's also for treatment and prophylaxis of venous thrombosis or pulmonary embolism. So it prevents all types of clots, and it's been used for many, many years. And Coumadin, if you will see, is also one of the narrow therapeutic window drugs, so you have to be very careful. A small dosage mistake or adjustment has a big effect, and there's a lot of different dosage strengths. It's available in a 1 milligram, a 2 milligram, a 2.5 milligram, a 3 milligram, a 4 milligram, 5 milligram, a 6 milligram, a 7.5 milligram, or a 10 milligram. And they're all different colors, and you should learn the colors and the strengths. It'll be something that you'll see a lot of it. You'll have to realize that there's a lot of drug interactions with Coumadin. There's a lot of diet issues if you eat something that is high in vitamin K. We're going to talk about that. Green leafy vegetables. If you take vitamin K is the antidote for Coumadin overdose. In other words, vitamin K, which is the generic name for vitamin K, is phytonadione, and the brand name prescription drug is called Mephyton in 5 milligram. Vitamin K, either by eating vitamin K rich foods or taking vitamin K itself, reverses the effect of Coumadin. So the advantage of Coumadin as an anticoagulant is that it has an antidote. The newer direct anticoagulants that are like Eliquis or Xarelto or Pradaxa. Pradaxa has a reversing agent. It's expensive, and there is a reversing agent for the newer Xarelto and Eliquis that's in the pipes, but it's not available yet. It may be soon. But anyway, that's one of the advantages, is that there's an antidote and there's a lot of strength. So you have to know a lot of things about Coumadin. Coumadin is amazing. It's been available and been used for 6 decades now. And it's interesting that it's still in use, and it has a fascinating story of how it was invented. And I was fortunate enough to know one of the doctors who worked at the hospital in Richlands here when I was working at CVS in Richlands for years, Dr. Stefanini, who worked up into his 90s before he passed away. He was an emergency room physician, and he was an oncologist, and he fought in World War II. He was an Italian that was in the Italian Air Force. He had amazing stories. He doctored Mussolini's cat. He also was on the team that discovered warfarin, or Coumadin. And warfarin, the name W-A-R-F-I-N, warfarin, A-R-I-N, WARF stands for the Wisconsin Alumni Research Foundation, and ARIN stands for the ending of dicoumarin, which was a chemical they isolated because of the molded clover disease with cattle that happened in the 20s. And in the early 30s, this Wisconsin Alumni Research Foundation team isolated warfarin, and then later in 1954 it was marketed as the brand name Coumadin, and it has been the mainstay of anticoagulant therapy for 6 decades, and it has been just an absolute life-saving, amazing medical discovery. That was, the cattle were dying from eating molded clover, and it was a big problem in Wisconsin, which was a big dairy industry, especially in the 20s, and they discovered that it was this dicoumarin related anticoagulant. So anyway, I'm interested in this type of thing. You're not going to have that on your test. I love interesting stories that are related to drugs and pharmacies. This is nothing that is you're going to have to know for your boards or anything, but you're going to have to know a lot about Coumadin, and you're going to have to learn a lot about anticoagulants. So this is an introduction in this lab to Coumadin and anticoagulant therapy, and as well as an introduction into narrow therapeutic index drugs. So we're also going to use an OTC phone call. Again, if your phone rings, answer it. I'd like you to be familiar with the agents that we have for fever blisters and for lip balms, like Vaseline, Carmex, Blistex, Campho-Phenique. So if you have a chance, I would like you to look up fever blister remedies and lip remedies, and maybe things like lysine or Herpecin L. Read up a little bit on that. You may get a question about fever blisters on the lip for a lip balm recommendation on the telephone. So I hope you have a good time in lab, and it's a very interesting lab with the dental gel. And dental gels are interesting to me because my father was a dentist for many years, and dentistry gave me pharmacy. So Just wanted to go over those things. We need to be aware of beyond use dating. We need to be aware of the dental gel and the lip balm, and need to be aware of the Coumadin prescription and read up on those things in your lab manual. And I hope you have a good day, and thanks for watching. Yes, Johnny Bill's Pharmacist World. Take care. Bye-bye.